Hi, it's Steph here. Welcome back to my channel. Today I want to talk about a tool that any clinicians, either a pharmacist or a nurse or a physician, can use to rapidly identify a patient who reports a beta-lactam allergy and who can safely receive Cefazolin. When a patient has reported beta-lactam allergy, such as to penicillin, and an order for perioperative Cefazolin is received in the pharmacy, I often hear pharmacists call the prescriber back to reassess the Cefazolin in light of the patient's beta-lactam allergy. There are 2 points in the literature that I'd like to bring up with regards to this practice. Number one is that for patients with a reported beta-lactam allergy where Cefazolin is avoided, there is a higher risk of getting a surgical site infection. Number two, recent evidence have shown that there is a lack of cross-reactivity between Cefazolin and other beta-lactam antibiotics if the reaction is an IgE-mediated allergic reaction. Given these findings, it makes sense for us to try to identify those patients with a beta-lactam allergy who can safely receive Cefazolin. This is a single-center study that was done at a tertiary care center site called Sunnybrook Hospital in Toronto, Canada, that looked at using the Accept tool to try to identify these patients. This study found that the use of the Accept tool significantly increased the proportion of patients who received Cefazolin despite the reported beta-lactam allergy without an increase in perioperative allergic reaction that is thought to be due to Cefazolin. The Accept tool depicted here is a simple tool that any clinician, such as a nurse, a pharmacist, can use to rapidly identify a patient with a reported beta-lactam allergy and who can safely be administered Cefazolin. I'll link you to this tool and this study in the video notes below, but I want to quickly walk you through how to use this tool in your practice. So first off, you want to determine the reaction that the patient had when they received their prior beta-lactam. Was the reaction a delayed reaction with systemic involvement, such as Stevens-Johnson syndrome or DRESS? If so, because of the lack of study demonstrating or supporting the cross-reactivity for these sorts of reactions, it is best to avoid beta-lactams, as shown in this algorithm. If the answer is no, then you want to ask yourself, is the offending agent that the patient reacted to in the past Cefazolin? If the patient previously reacted to Cefazolin with an anaphylaxis-like reaction, then avoid Cefazolin. However, if it was not, then going down this algorithm, you can see that it is safe to give Cefazolin. Note that in the yellow box below, it states that Cefazolin can be safely given to patients with an IgE-mediated reaction to penicillin and other cephalosporins due to a structurally different side chain without any cross-reactivity. Are you ready to use the Accept tool in your practice? I hope this video gives you the confidence to use the Accept tool in your practice so that we can reduce the rate of surgical site infection, as well as reduce the use of more toxic agents such as vancomycin when patients with a reported beta-lactam allergy can be safely administered Cefazolin.